All right, we're here at Hinderks Chiropractic's new location here in Renville, and we're gonna go inside and talk to Jeremy about it. I'm Austin, and I'm here with Hinderks Chiropractic, and this is Jeremy.
Hi, I'm Dr. Jeremy Hinderks, and we have our Hinderks Chiropractic location right here in Renville, just 2 blocks away from the school. We opened here in 2008. We first set into the old movie theater building just up the street, and in September of this year, we actually moved into this new location.
When did you first start practicing as a chiropractor?
So I graduated from chiropractic school in 2008 and moved back with my family here and first practiced in Wilmer, Minnesota under another doctor for about 5 years. And then in 2014 is when we officially branched out on our own and I was able to have my own practice.
Okay, and you recently moved to this location?
Yeah, so this building used to be a dental office, and over the years I kind of had my eyes on it if it would ever be available, and recently it became available, so we were able to kind of move over here and expand our operation a little bit.
What are your hours?
So we're here in this office on Mondays and Wednesdays. We see patients from 10 to 1 and 2 to 5. And then we also have a location in Wilmer, and I go to that office on Tuesdays and Thursdays. So I kind of flip-flop between the offices right now. Ideally, I'd like to find another chiropractor to take over the Wilmer clinic so that we can kind of focus and be here more often.
How do you like being a chiropractor?
You know, it's really a rewarding position. We see a wide variety of patients, from babies to the elderly, athletes to the working adults. So it's kind of nice because I can see a lot of people, a lot of different issues coming in. And contrary to popular belief, there's more to chiropractic than just treating back pain. Really, we take a whole body systemic approach to try to heal conditions through healing the spine.
So how come you wanted to get into chiropractic?
When I first started into college, my first 4 years of college were at Concordia, Moorhead. I was a pre-medical, actually. So I always knew I wanted to do something in healthcare and helping people. But it wasn't until later on, after college, I was actually playing baseball kind of around the country. And one of the teams I was playing for had a team chiropractor. And I had never really had a ton of experience with chiropractic, but just the way that I was able to feel and perform when I was under that kind of care, it excelled my performance, it excelled the way I felt inside, just with my health and energy, and it really just sparked the interest for me. And so then after I retired from baseball, I pursued a career in chiropractic.
Yeah, because 2 years ago you came before every football game and you adjusted all the players, and that did feel good.
Yeah, so I've been adjusting the football team since I moved out here in 2008. That's been really rewarding for me because it kind of helps keep me familiar with who's in school and who's in the sport. Something I really enjoy doing. So, yeah.
Alrighty, well thank you. If you'd like to show us around real quick.
Absolutely. So in this office, this is kind of where we do most of our patient education. You can see we have the posters up here just to kind of show the different layers of the body, from the skeletal system to the nerve system and the muscle system. And then we talk a lot about how those all affect each other. And then this is kind of a high point here too, because this shows how each level of the spine is in charge of a different part of the body. So this is where we do a lot of our kind of patient education. These 3 rooms is where we focus on the chiropractic adjustment, which is kind of the basis of what we do, is freeing up stress off of the nervous system so that the body works better. Another strategy for helping the body work better and remain healthy is detoxification. And that's what we do in here. And another good visual here, what different toxins can do from different parts of the body. So by detoxifying the body, we can help reduce joint pain, muscle pain, kind of boost people's energy, and just help the body get rid of those less than favorable things that it likes to hold on to. Those are the kind of things that cloud our system and tend to cause more disease. So that's what we do in this room. We actually do a foot basin and we charge the water with a negative ion bath, which helps to pull toxins out of the body. So a lot of times during the day, you'll see two people sitting here getting their foot baths, their detox in. Then as we cross over here, we focus a little more on the muscle side of things. So we've got a nice massage chair in here. So if someone comes in and they're just kind of still too tight for an adjustment, they're not feeling comfortable enough to relax, we'll kind of put them in here, let them kind of mellow out a little bit, give them a nice little massage in the chair. We also do professional massage therapy back here, and that is this room here. And that is, we have a massage therapist, her name is Amy. So if you're gonna get a professional massage, this is gonna be kind of the setting. Real low lights, real soft music, just kind of trying to relax the body to prepare for that chiropractic adjustment. And then last but not least, we'll head down to this area here. And this is where we do more of our injury care. If someone's in a car accident, or let's say they have a sports injury, this is an area where we can use some modalities such as interferential current, electric muscle stimulation, ultrasound therapy, and our newest addition here is red light therapy. Red light therapy works by energizing the cells so that they can heal faster. It's really exciting technology. Uses infrared light, and you feel a little bit of warmth with it, but it doesn't burn. It's not like a tanning bed. What this does is it helps boost kind of the battery pack or the mitochondria of the cell. So when a cell is damaged from an injury, it can actually heal faster, which is great, because people, when they're suffering with an injury or they're in pain or they're having a problem, they really want to get through it quickly. And that's why we're here, is to kind of help them heal faster, get back to their job or get back to their sport or get back to what they're wanting to do a little more quickly. So that's kind of the gist of our office. A lot of what I do is patient education, teaching people why these things work and why they should do them to feel better. So.
All right, well, thank you so much.
Absolutely, my pleasure.